So hi there, I'm Emily Woodcraft, and I'm also a third year medical student, and I'm just going to talk about the transition into the medical community as a whole. So I'll talk a little bit about transitioning into the kind of medical school side of things, so here it is, and then I'll also talk about the kind of clinical side of things, because they're quite a unique environments that you might not have previously had any kind of experience in. So yeah, starting off with the medical school environment, obviously the workload is heavy. There is a lot of content to learn in medicine. Like Amy was saying, you've got to really work out a nice kind of work-life balance. But I think my main advice for this, because obviously we can't reduce the amount of content that you need to learn, unfortunately, but the main kind of advice I have for you about that is setting realistic expectations for yourself and being flexible in how you work. So everybody works differently. Everyone has their own kind of way of learning. Are you a visual learner, etc. And I think for first year, you've got the time to try out different revision styles. So, maybe like working with mind maps. And also there's the fact that I kind of split medicine into sort of three main areas. You've got the clinical side of things. So that's things on placement, working with patients, and then you've got anatomy, and then you've got biomed. And for example, when I do revision for clinical things, it's very different to how I revise for biomed and anatomy. So it's kind of working out what works best for you. Don't be afraid to try out something new, and also don't compare yourself to what others are doing. So for some people, working hours a day in the library, just going over notes all the time is helpful for them, and how they revise and how that works out for them. And that's great, but for some people that might not work out so well. So just kind of, again, with the imposter syndrome, don't be comparing yourself to how others are doing. Just give yourself the time to adjust and experiment with different styles and find out which ones work for you. And then also, I think another key thing about medical school is that you have a really big community of lecturers and teachers, tutors, etc., who want to help you. So don't be afraid to ask them for help, along with your peers in the medical school, so your classmates, your friends. Don't be afraid to stay after a lecture and just have a chat with the lecturer about maybe if there was something that you didn't understand so well, or even if you're just kind of interested in the topic. Teachers can really appreciate you being enthusiastic about their specialties. So don't be afraid to kind of, maybe in the environment of COVID, popping them an email would be the thing to do. But yeah, so ask for help. Generally, people that go into medicine do it because they want to help other people. So don't feel like you'll be a burden, or that you're wasting their time, or that they won't want to answer your question, because they most likely just want to help, and everybody just wants you to succeed. So yeah, don't feel like you're being a burden or anything. And then lastly, I just wanted to talk a little bit about the student community. So I've got a few different societies. So as well as your medical student peers, there's also kind of wider societies in your medical school. So these are just ones I quickly found from looking at the Exeter one. So whatever you're interested in, it's important to have a life outside of medicine. Obviously, it's really important to put the hours in, put the time in, but at the end of the day, what will make you a good doctor is not just the academic side of things, but also how well-rounded of a person you are. And things like, maybe if you're into knitting or you're into baking, being part of society can really help you to take better care of yourself, and be a good use of your free time to wind down and chill out between revision sessions. And then also there's the opportunity to, for example, if there's a society that you really enjoy being a part of this year, in your first year, then maybe in your second year you might decide to join the committee of it. So for example, I'm on the Wellbeing in Medicine committee, and I feel like the skills I've learned from being on the committee are really useful for kind of going off into medicine, skills related to networking, interpersonal skills and social skills and things like that. So just kind of don't feel like if you're not doing medicine stuff all the time that it's necessarily bad and won't help you to be a good doctor, because there are so many different skills that make you a good doctor. So yeah, and then the next slide. I'm not in control of my slides at the moment, so sorry for the delay. So yeah, so the next I'm just going to talk about placement. So I only do this quite briefly because I'm sure in first year you won't have as many placements, but there are some universities like Exeter, for example, where we do monthly placements, so you can be exposed to the clinical environment quite early on. But yeah, so I've just got a little word cloud here that has all of the, well, not all of them because there are many, but some of the different roles that people have within the multidisciplinary team. So the MDT, which I'm sure is a buzzword that you've heard from prepping for interviews. So really there is a massive team of people in medicine, and it's kind of all about working towards the same goal of helping out your patients. It might feel like the consultant is a bit daunting or kind of asking you too many questions, but at the end of the day, everybody wants to help each other out. So don't be afraid to ask questions, and don't be afraid to ask if you can practice a certain clinical skill. If you're learning clinical skills in first year, things like taking histories, don't be afraid to ask if you could practice it, because the sooner you start practicing, the more experienced you'll get, and the better you'll be when it comes to having proper placements and things in third year and onwards. But yeah, so be enthusiastic. Everybody on the team really is very likely to warm to you more if you are enthusiastic and interested. And then lastly, I just wanted to quickly talk about online medical communities. So there are loads of different spaces online for medical students. So from all the way at the bottom of the hierarchy, I've kind of got it in order of formality. We have things like memes, so pages where you can share different like kind of funny images and stuff with each other. And I think it can be really good to have these spaces so that you can kind of see that you're not in it on your own. So maybe if you kind of in your school are seeing that everybody around you is maybe kind of achieving really well, and that feeling of imposter syndrome where, you know, you're really struggling with a concept, for example in this one, if you're not understanding action potential and you think, oh, everybody else understands this, but I just can't wrap my head around it, and then the feelings of, you know, imposter syndrome kick in, and then you see something like that and you think, oh, you know, I'm not on my own. These can be kind of really helpful with those feelings of kind of lack of self-worth and things like that. But yeah, kind of moving up, there's Facebook groups and pages. So for example, the SDocs page, of course, is a good one to follow for that kind of feeling of community, as well as good resources for if you're actually learning or wanting to revise. And then there's Instagram pages. So my personal favorite is Mnemonics. So they just, they post kind of different mnemonics that help you remember different concepts in medicine, which I find really useful because I like having things dumbed down to simple kind of things like that, so I can help remember them. And then there's Med Twitter is a really good hashtag to follow. So it's a little, I've kind of said that it's a little bit more formal because there are people like consultants and other kind of medical students are generally on Twitter using this hashtag, and I think it's quite a good space to get your head into what is happening currently in medicine, kind of what are the hot topics that consultants and doctors are talking about at the moment. So it can be really good to get involved with these spaces or just kind of have a read through, and it kind of pulls you away from the sort of pure academic side of things and back into like, oh, this is real, like this is people actually being helped by medicine, or kind of interesting, innovative, new things going on that can kind of really get you excited about medicine again, and like motivate you to go back and revise different concepts. And then lastly, of course, as LinkedIn is kind of the most professional platform, but mainly you can just use it if you ever want to reach out to people for research or placement opportunities. So it's kind of always worth just having an account, even if you don't check it a lot. It's nice to just have that building up in the background. But yeah, that's all from me. Thank you so much for listening, and now we're going to hear from Nuria about nutrition and health.